Okay, right. Let's get started. Hi, everybody. Welcome to our second class of our hand and dexterity exercise series. I know we have some new people today, so I'll introduce myself again. My name is Shelly. I'm a neurophysiotherapist and I am also a staff member at Parkinson Society BC. You may have seen me before in the past in our many exercise webinars. So our hand and dexterity webinar class is a little bit different to our usual exercise class because like the name implies, it's solely for our hand and dexterity function. So there will be no standing in the class. We're going to be seated the entire time. If you had a lap tray or like a table in front of you, even better. That way you can rest your elbows on the table as we go along today. So in terms of things that we're going to need, you're going to be needing a little towel. So I've got a little towel here. It's a kitchen towel or a tea towel. So something small that you can use today would be great. Because as you'll see later on when we do the exercises, it's better when you don't have a giant bath towel. And today we also have a little cushion. So I know someone asked about this last time. So this is the size of the cushion that I'm using. It doesn't have to be this size or shape necessarily, but ideally you want some kind of corners on all sides. And the size should be relatively small, so not a giant pillow that you would normally use for sleeping. So those are the two things we're going to be using today. And as we go along the class, just follow along and try your best for the different activities that we'll be doing. It doesn't have to be fast. We're just going to try to challenge our hand and dexterity function a little bit more. Because we are seated for the class and we're going to be using our hand function, you want to try to make sure you're sitting in a chair without armrests if you can, just so that way as we go along, we don't accidentally knock our elbows on the side. But of course, if you only have a chair with armrests on it, that's fine as well. Just be a little bit mindful that you're not going to accidentally hurt yourself as we're doing the class. You'll probably notice as well that there is a chat box in our webinar platform today. So it should be on your right-hand side, a chat box. If you don't see it, it might be collapsed. So if you look at the bottom of your screen, there might be a little blue circle. And if you click on it, it should open up into the chat box. Now in the chat box, at the very top, I've pinned our email address there. So it's info@parkinson.bc.ca. If you want to contact us with any questions or any suggestions for things you would like to see in our hand and dexterity classes, you can, of course, feel free to drop us an email. The class is recorded, so you can go to our YouTube channel and watch the recordings afterwards if you like. Our week 1 recording is already up on the YouTube channel. So if you're not sure where to find that, drop us an email and we will send you the link for our YouTube link. Okay, so without further ado, let's get started. If you did have any questions throughout the class, we won't be able to hear you, but you can feel free to type in the chat box and I will answer the questions as we go along. Okay, great. So I'm going to shuffle my chair back because we're going to start with a bit of warm up. So like I mentioned last time, even though the class is solely for hand and dexterity, we do want to make sure we warm up the arms, shoulders, chest, upper back, neck, and everything as well, just because everything's connected. And if you're not in a great posture, everything above your arm, you can't really expect to have great hand function either. So we're going to start by sitting at the fronts of our chairs, just so that way we're not slouching back in the chair or leaning to one side. We want to try to sit with our backs up nice and tall, sitting right on our sit bones, letting the arms hang down by your side. And we're going to start by rolling the shoulders up to the ears and back. So you're rolling them back in a circle. Nice and gentle, doesn't have to be quick. If this doesn't feel great for you right now, it's okay. We're getting warmed up, so you can try to start with the movements a little bit smaller, and then as you get a bit warmer, you can make the circle slightly bigger. So we're warming at the tops of our shoulders here, thinking about reaching those shoulders up to the ears, and then rolling them back. Good. Good. And as we're doing this, we're going to just be mindful that when we do roll our shoulders, that we're not going to do this with our necks, right? You want to try to keep them nice and long as well. Good. On the next one, we're going to add in our elbows as well. So same circle. We're just going to have those elbows circle back as well, just so we can start to get the arms involved. Still trying to keep the head up. We're not scrunching our neck like so, right? Nice tall posture. Good. And then we're going to involve the entire arm now, circling back, adding both arms. If you're somebody with a little bit of shoulder issues and you can't reach your arms all the way up, that's okay. You can just go as far as you think you can, as far as you're comfortable doing, as long as we're still trying to do these circles with the arms. Good. I can see some questions in the chat box. I will read them after our warm up and I will answer them as we go along. I hope that's okay with everybody, just because I'm a bit further away from my screen and I can't quite see the questions right now. But I know they're there. I will get to them. Okay, let's do two more here. One more. And drop the arms. Let the arms hang heavy, still sitting up nice and tall. We're going to bring the chin down towards our chest. And then we're going to do a bit of a semicircle roll with our neck here at the bottom, like so. Making sure as we're doing the semicircle neck roll, we're keeping our arms down, so keeping them heavy, dropping to the floor, so we're not lifting our shoulders like this, right? We want to keep them down. It's just the head moving right now. In the semicircle, we're still sitting up nice and tall. Good. And when you feel ready, you're going to start taking that circle a little bit further. So that way you go all the way around the top and back down, just in one direction for now. And it doesn't necessarily have to be really big right now. Just move at a range that you feel comfortable currently, given that we've only just started warming up. Taking your time, trying to get all corners of the room with the crown of your head. Keeping those shoulders down, still sitting up nice and tall if you can. Let's do one more here. Good. We're going to go in the other direction. All the way around if you can. Nice and gentle. Good. Let's do one last one. And rest there. We're going to float both of the arms up in front of you like so. And you're going to pull those elbows back. Squeeze the shoulder blades together such that, if I go sideways, it kind of looks like your elbows are reaching behind you, right? And then you reach them forward again. So keep going with that. Squeeze the shoulder blades back. Good, and forward again. Pulling those elbows back, squeezing the shoulder blades together, still sitting up nice and tall. Let's do two more. Pulling those elbows back. And one more. And we're gonna drop the arms. Okay, a little bit of sensory work to just wake up the little nerve endings in our arm. We're gonna hold one arm up in front of us. So the back of the arm is facing the ceiling. You're gonna take your other arm and you're going to start at the shoulders and you're gonna gently squeeze down the arm, just to give yourself a little bit of sensory feedback there, waking up those nerve endings, getting your brain to remember that this arm is here. Making sure when you're squeezing, you're going all the way down to the fingertips. We're not forgetting about the fingertips, squeezing all the way down. And then we go all the way back up. Good. And then coming all the way down again. Squeezing all the way down, nice and gently, not too hard. You don't want to hurt yourself. You're just trying to wake up the nerve endings a little bit. Good. And then we're going to rest the arms and switch sides. Same thing on the other side. So we're working both sides, right? Starting at the shoulders, squeezing all the way down the arm towards the fingertips. Not forgetting about the thumb or the palm. And then we squeeze all the way back up. Good, and we're gonna do that again. Nice and gentle, just waking up the nerve endings here. Squeezing the ends of the fingers as well. Not forgetting about the palm and all the way back up. Are we still sitting up nice and tall? If not, correct your posture, sit nice and tall. Rest. Okay, other arm again, reaching out. This time, you're gonna take your hand and you're gonna start at the shoulder. You're gonna gently pat all the way down and all the way back up. Again, giving a little bit of a different stimulation this time. Gently tapping all the way down towards the fingertips and all the way back up. One more here. And all the way back up. And then same arm, you're gonna flip it over. So we got the other side of your arm that you're tapping all the way down to the fingertips and all the way back up. Good. So remember, as we're doing this, we're not smacking the arm, right? So we're just gently tapping the arm. I don't want you to hurt yourself. So we're just doing this because we want to wake up the little nerve endings in your arms and just kind of remind the brain, stimulate the brain a little bit, recognizing that the arm is still here. So that way you draw your attention to the arms. And then when we start doing the exercise, make things a little bit easier. Okay, let's do the same thing on the other side, back of the arm. And you're gonna start at the top of the shoulder, gently tapping all the way down to the fingertips. And all the way back up. So nice and gentle, still sitting up nice and tall. We're not all of a sudden slouching down to one side, getting lower, but you wanna make sure you're still sitting up nice and tall, right over those sit bones. And all the way back up. Good, and then we're gonna flip the arm over, exactly the same, gently patting all the way down, just giving yourself some sensory stimulation. And all the way back up. And all the way down again. And all the way back up. Maybe one more. Good, and rest. Okay, this time, you're going to bend both of your elbows like so. Just tuck them in, gently bend them up, palms facing upward. From here, we're going to do a bit of a forearm twisting motion. So my palms are facing up, and then I'm going to turn my forearms down, trying to get both hands even. If one side is kind of like this, you want to concentrate on it and try to get both sides even, such that it's almost like you're pointing your thumb to the floor. And then you're going to go the other way, flipping the palm up such that your little fingers are trying to face the ceiling. So giving your forearm a little bit of a stretch here, making sure we're bending the elbows, right? Because doing this movement of having the elbow bent versus this movement is very different. When my arm is straight, I'm using my shoulder to rotate, whereas when my arms are bent, I'm using my forearms, which is what we're looking for here. So a lot of the times we don't realize, but your forearm movement and your wrist movements are actually pretty important for hand dexterity function. It's not just about the palm or the fingers, but it's also about the rest of the arm moving as well. So things like opening a jar would be grip strength, but also a bit of forearm and wrist action as well. So you want to make sure you're able to do a bit of everything. Good, last one. And rest. We're going to take one of our arms and we're going to take the wrist. So I'm going to turn sideways so you can see me. We're going to gently press the wrist downward like so. So it's almost like your palm is facing down to the floor. And you're going to take your other hand and just gently press down a little bit further. Not really far, but just a little bit more of an overpressure for yourself to feel some stretch down the arm. And then bring it back up. We're going to do the same thing going the other direction this time, going down as far as you can. Take the hand and you're going to gently just press down just to stretch that forearm a little bit more. Nice and gentle. Just being careful here if you have any wrist pain. You don't want to be pushing too far, but you do want to get a bit of a stretch. Same thing again, other side. Good. And then opening to the back. Good. And let's do the same thing on the other side. So again, you bring that wrist down. So noticing here how I'm not moving my arm like this, right? It's just the wrist coming down. And then you're using your other hand to just gently apply a little bit more of a pressure there, just so you get a good stretch. And then you bring it up. Same thing to the other direction, bringing that wrist back, using your hand gently pressing down just a little bit. And back up. Same thing, get down with the wrist. And back up. One last time, going back with the wrist, gently pressing down, just stretching a little bit more. Bring it back up. And shake out the hands and rest. Okay, I'm gonna come closer now so you can see me better. And I can read these questions. Okay, the first question is, are these exercises good for arthritis? The answer is yes and no, which is probably pretty vague. Yes, because we are strengthening some of the muscles. And when you have arthritis, the main, main physio treatment you do for arthritis is really strengthening the muscles around the affected joints in order to get the muscles to be stronger, to be able to cushion and support the movements of the arthritic joints more. So then you can manage with less pain, you can still move around better. So in that case, yes, still good for the arthritis in terms of these exercises. But at the same time, you do want to be careful because if your arthritis is pretty severe and you're having a lot of pain, a lot of issues, then you might not want to press into the over ranges like what we just did there as an example. There's a question about trigger fingers. So with trigger fingers, yes, the exercises can kind of address the issue because they can strengthen the muscles that you might not be using as much as a result of the trigger finger, but it won't fix your trigger finger problem necessarily. Because that's with trigger fingers, it's got more to do with things like your ligaments and tendons in your hand, which will be not something you can necessarily address with the exercises. But if you have issues with trigger finger, I would definitely suggest for you to speak to your family doctor and see whether you can be referred to an OT, for example, for hand therapy or any other kind of treatments that might work for you. There is someone who says they can't hear me, video keeps freezing. Hopefully you can hear me now. On my end, the internet looks okay, but if it's freezing for you a lot, try to refresh the screen. Sometimes that can help because if there's a lot of people on the platform, which is the case for this class, sometimes it can freeze a bit. So usually when you refresh the browser, that fixes the problem. Okay, so now that I'm closer to the screen, we're going to hold both of our hands up and we're going to start with the first exercise here. So you can't see, but I've got a table in front of me here, and I usually rest my elbows on the table like so, just so that way we're not having to spend the whole class lifting up the arm, but you still want to be able to support your arms a little bit and have the workout in your hand. So here's what we're going to start with. We're going to start with squeezing the hand into a fist as hard as you can for just 5, 4, 3, 2, 1, and then we're going to open the hand as wide as we can. Noticing how my fingers are all separated and they're all pointing outwards. And then we're going to do that again. Squeezing back in for 5, 4, 3, 2, 1, and opening back up. Good. And again, coming back in, squeezing for 5, 4, 3, 2, 1, and opening back up. Let's do one more here. Squeezing in, trying to get both sides even. Squeezing, hold for 5, 4, 3, 2, 1, and opening the hand back up. Good. Now, keeping our hand open, we're going to practice some of our finger opposition exercises that we did last time. So having your hand open, you're going to try to keep all of them, all the fingers where they are without moving them. And you're going to bring your index finger to touch your thumb. And notice how as I'm touching my index finger to the tip of my thumb, the rest of the fingers stay up. So I'm not all of a sudden doing this or having them come in. But the purpose here is you're trying to keep all the rest of the fingers upright in the same position. And then you're going to open back up. And then you're going to try to do the same thing with your middle finger, touching your thumb without the other fingers coming in. You want to keep all the other fingers up and separated so they're not touching in like this, but you want to keep them open. And return the hand back to its original position. Now you're going to do your ring finger touching your thumb, the rest of the fingers facing upward. And open back up. Now the little finger touching the thumb, keep the rest of the finger upward if you can. And then you're opening back up. We're going to do the same thing in reverse, starting with the little finger and then moving all the way back to our index finger. If this is really hard for you to do with both of your hands, feel free to just do one at a time. If it's too much for you to think about, that's okay. Drop one of the hands. Just do one at a time for the moment. That's okay as well. As long as we're trying to adhere to the right technique of having all the fingers pointing up, having none of them curled down like this, right? Want to try to separate them as much as we can. Because when we're talking about hand dexterity, a lot of the times your issue with hand dexterity is not necessarily, the big muscles in the forearms or the hand that's weaker, but it's usually your ability to isolate these muscle contraction and moving your fingers separately happens to be the problem. So we try to separate and isolate these movements as much as we can in this class. So selectively choosing to move one finger, but then keeping the rest completely still. And open back up. Keep going. Little finger. Take your time. You don't have to necessarily do the same speed. If you want to go slower, please feel free to go slower. If you want to go faster, you can go faster as well. As long as when you're going faster, your fingers aren't doing this all of a sudden, right? And we're still sitting up nice and tall. We're not slouching down to one side. Trying to keep your back tall, head reaching up to the ceiling as much as you can. Good. And index finger. Trying to keep the rest of your fingers pointing upward. We're going to do one last round here. In your own time. Making sure you always return the fingers into an open position before you move on to the next finger, right? So we're not going like this and then switching right away. You want to open back up each time before you switch to your other finger. Excellent. And reversing last time. That's it, keeping the rest of the fingers up if you can. Good, and last one. Opening back up. And shake out your hand for a second. Whew, it does get quite tiring, doesn't it, when you're trying to do them and open up your hand. Okay, our next exercise, we're going to do one hand at a time because this one's a little bit more difficult. We're going to hold up one of our hands, and I want you to try to keep the hand as flat as you can. So it's almost like if you place your hand on the shop window and you're looking inside the shop window, you've got the hand against a flat surface, and that's what we're aiming for here, trying to keep the front of the hand as flat as you can. And you're going to start with all of your fingers touching together, like so. And then what we're going to do here is keeping the hand nice and flat. We're going to open the first web space here. So just this space opening, the rest of the fingers are still squeezing together. You probably remember this from last week, and you probably hate this one from last week. And you're going to bring that thumb back in. Now you're going to open the next space over, like so. So you can see here, when I open this space, this is the only one that's open. The other fingers are all stuck together, right? Making sure it's nice and flat. We're not curving in like this. And then you're going to close it again. Now you're moving on to the next space here opening. Notice here how the rest of the fingers are all together. This is the only space opening. And my hand is still nice and flat. So if I go from the side, still nice and flat. I'm not, doing this kind of curving movement. You're keeping it nice and flat. And bring it back in. Good. Now the next space over. Good. Keeping the rest of the fingers together. Hand nice and flat. Just the space opening. And close it back in. We're going to do the same thing in reverse, starting with this last space here opening, keeping the hand nice and flat, thumb nice and flat. We're not curving in. And bringing that little finger back in. Next space over, opening without the other fingers curving in. So if I go from the side, you can see nice and flat, right? Nice and flat. And bringing it back in. Next space over, making sure all the other fingers are still stuck together. That is the only space here that you're opening. Hand still nice and flat. And bring it back in. Next space over. Nice and flat, not letting the thumb come in front or behind. And closing again. Let's do one more round on the side. And coming back in. Next space over. And coming back in. Well done, everybody. I know this one's a little bit tough. Next space over. Especially because this one, you're trying to keep your hand flat, which is, I think, the most difficult part. And coming back in. Last space here. And back in. And in reverse. Good. Take your time if you need. It helps when you look at your hand and you can see what you're doing. So it's always good to actually do your hand dexterity exercises in front of a mirror, because then you can have that kind of visual feedback as well and you can see what it looks like. Or you can just look at your head. Good, shake it out. Well done. Okay, let's do the same thing on the other side. So we're going to start with all the fingers together, the hand nice and flat. So think about the idea of pressing your hand against a shop window and you're peering in. So you want the hand to be against a flat surface. And then you're going to open up the first space here without the other fingers curving in, right? You want to keep it flat. So if you looked at it sideways, it looks flat still. And bring it in. Next space over, keeping the rest of the fingers together. If this is really difficult for you to do freehand when your hand is sticking up like that, you can actually also try putting the hand against a wall, against your table, against a mirror, and then kind of sliding your fingers. That gives you a little bit more of a feedback, and it can sometimes make things easier for you to start with. Good. And in reverse, making sure to just check your hand. Is it still flat? If it's starting to curve, see if you can straighten it up a little bit more. Next space over. And the next one over. And the last one. Good, let's do that again from the beginning. Hand nice and flat, fingers still straight. Squeezing the fingers together when you're not using them. So when you're not opening that space, you can squeeze the rest of the fingers together. Next one over, making sure we're not splaying the hand back or bending it down. Keep it nice and flat, almost like it's against something. And the last one. And then we're going to reverse it again. Good. Taking your time if you need. It doesn't have to be fast. Of course, if you get really good at this, by all means, you can challenge yourself and try to go as quick as you can. But for the moment, because we're just learning these movements, just do them slow, get the right muscles activated, and then you can work your way up from there. And shake it out. Good. Okay. We're going to now leave that one and we're going to take our little towel. So remember our towel, we're using a small kitchen towel, right? So not a huge one. And the reason for that, you'll see in a second when we do the exercise. So you're going to start by holding onto the corner of your towel, okay? The corner here. And you're going to use one of your hands first. It doesn't matter which one because we'll do both anyway. But start by holding on to the corner here. And what you're going to do is you're going to think about keeping your palm facing downward the whole time. So I don't want to see anybody's hands do this or sideways. You want to keep the palm facing down, okay? So holding on to the corner, you're going to use your fingers, all of your fingers, including your thumb, to start to scrunch up the towel into a little ball. So noticing here how my palm is facing down the whole time. And the reason I'm asking you to do that is so that way we're not cheating by doing this and scrunching it up, because it's easier this way when gravity is kind of helping us and we're flicking the towel into our hand. But if you hold the towel like so, so it's dangling down, and then you're trying to scrunch it up into your fist, it's a lot harder. And this exercise in general is pretty tough. So go slow, use all of your fingers. Don't let any of your single fingers get stuck inside the towel, but you want to try to use all of them. And by all means, you can place your elbow down on the surface. So that way you don't have to hold up your arm necessarily. So we're just concentrating on the fist. And when you've scrunched up as much as you can and you can't scrunch up anymore, just grab the towel and shake it out, and then we're going to start again. Okay? Now, what I don't want you to do is start to do this against your shirt or against your hip or against the table, because it makes things a lot easier when you're using a surface to scrunch the towel against. But if you do it freehand like this, it's a lot more difficult, and that's what we're going to aim for here. Is you're trying to scrunch up the towel without having to place the hand on anything. But of course, if this is impossible for you to do, it's very difficult, then yes, don't worry. You can use the table or your shirt or your leg or something like that to help you scrunch up the towel. But as much as you can, try to do it freehand. And then when you can't go anymore, you can shake out the towel and start again, making sure you're starting at the corner each time. Make sure you take your time with this one as well. So you're using your fingers to pull the towel in and then using your thumb to kind of clamp them down as you free your other fingers to then scrunch again. Trying to use all the fingers at some point because otherwise we kind of sometimes have a couple of our fingers just stuck underneath and can't quite pull them out without the towel unraveling. Well done, everybody. I know this one's tough. Try to get all the fingers moving. Let's do one more on this side, and then we'll give this hand a break. So wherever you are in your towel scrunching, either finish it or you can restart another round, and we'll just do it one last time. And shake it out. And drop the towel, shake out your hand. You can rub your hand a little bit if it's feeling a bit sore. And we're going to switch to the other side. So on the other side, same thing, holding onto the corner of the towel, making sure your palm is facing downward, right? So that way you're kind of pulling up, kind of like a jellyfish, if you will, with your fingers to scrunch up the towel and trying to do it freehand rather than have it against your shirt or a table because it makes things easier if you're scrunching up against a surface. And just take your time. There's no rush. And then when you can't scrunch up anymore, you can just shake it out and restart again. But make sure you're taking your time. So don't rush. This one's a bit harder. Trying to get all the fingers moving. Well done, everybody. Well done. Do we hate this one yet? Shaking it out, starting again. Pulling in. You'll probably notice as well that one hand is easier than the other when you're doing tasks like this, and that's okay. There are always differences between either side, especially if you find your Parkinson's affect one side more than the other. But keep trying. Take your time with this, trying to get all the fingers moving, and then shaking out the towel and starting again. Let's do one last one here. So wherever you are, you can finish off the round that you're doing, or you can, if you're just about finished, you can start a new one and this will be the last round and then we can move on to something else. So there's a question, if you can't do the towel at all in one hand, then what I want you to do, if you can't do the towel at all freehand, I want you to have it on a table. Start with your hand in the middle and start scrunching like so. So if you can't do it like what we just did, scrunch from the table like so. If that's still really difficult, have it on the table, have the hand that you're working on in the middle. Try to scrunch up as much as you can. Use your other hand to pull things inwards just to make life easier. But generally, if you can't do it with one hand freehand up in the air like so, have it on a surface because it makes things easier. The towel doesn't move as much and it's easier for you to scrunch up like that. Okay? I'll just give you another minute here just in case you're trying that one now. Probably all going to have sore hands after this. Good stuff. Much better. Okay, good. And then shaking out the towel. Whew, let's have a rest. Let's put the towel aside. We'll leave that one now. We're going to grab our cushion. So our little pillow or cushion. So remember, the smaller the better. Okay. And I'm just going to move my screen down slightly so you can see this better. Okay. So hopefully you can see me still. So we've got the cushion here, and what we're going to start with, so I mentioned at the beginning that ideally you want to have corners, right? Yeah. So if you don't have anything with corners right now, don't worry, you can grab whatever end you like. But if you do have corners, I want you to hold on to the corners like this with either hand. So you can see, because my pillow is a square, it kind of looks like a diamond shape now because I'm holding on to the corners. And I want you to get your entire palm onto the pillow. So we're not holding with just the fingertips. We're getting the entire palm onto the pillow like this. And what I'm going to get you to do is we're going to start by squeezing the pillow as hard as we can and trying to get your hands to come as close together as you can. So essentially, you're gripping the pillow and squeezing it inwards, trying to get those fists to touch in the middle of the cushion, and then relax it back out again. And then we start again, making sure your palm is against the pillow, right? So we're not like this, but the palm is against the corner of the pillow. And you're going to grab hold and squeeze and get as much pillow into your fist as you can, squeezing inward, holding for just a few seconds here. And then you're going to open it back up. So a little bit of grip strength here, just to start with. Again, so thinking about the palm. And then you're squeezing inwards, grabbing, using those fingers. Grab hold of as much of the pillow as you can. Squeezing for a few seconds here. And then open. Your elbows don't have to stay close to the body if you don't. If you prefer to have them out like that, that's okay as well. But keep in mind, when your elbows are out like this and you're squeezing, you're probably going to be using more of these muscles here. Not saying that you're not using your chest when your elbows are down. You are as well. But the idea of having your elbows down slightly is just so that way you kind of use your grip strength a little bit more to kind of push in and grab as much as you can versus me. Can you see how here I'm not using my fingers at all, but I'm kind of using my shoulders to push in? So that would be the only difference there. But do whatever you feel is comfortable, because I do want you to be able to do the movement. So I've just switched my pillow over because it's starting to get deformed. So I'm using another corner now. Same thing, get the palm right against the corner of the pillow. So not the fingers like this, the palm on both sides. And then you're going to squeeze and use your fingers and almost like you're collecting as much of the pillow as you can into your palms. Your grip is relatively wide. Squeezing. And then you're opening back up. And then we're going to do the same thing, squeezing it. I promise this is going somewhere. We're just starting with the squeezing for the moment. And open back up. Let's do one more here. Really concentrate on getting as much of the pillow into your palms as you can. Good, and rest for a second. Okay, so now here's what we're gonna do. I'm gonna move back a little bit so you can see me better. Now with the pillow, we're gonna start at the bottom corners of the pillow, okay? So see here, my hands are holding the bottom corners, right? If you don't have corners, if it's a round pillow, I also want you to start at the bottom. So whatever shape pillow you have, start at the bottom, okay? So for me, I'm starting at the bottom corners. Here's what we're gonna do. Elbows are gonna be down and relaxed. We're not sticking them out, relaxing. Your shoulders are relaxing as well. Here's what we're gonna do. We're gonna hold on to the bottom of the pillow, not squeezing very hard, you're just holding lightly. And then in a second, you're going to open both hands, let the pillow drop, and then catch it again at the top corners of the pillow, okay? So I'm just doing it slowly right now to show you. So you're opening both sides in a second. The pillow's gonna start dropping because of gravity, and then you're gonna try to grab it at the top before it falls out of your reach completely. So it looks like this. Okay, so I'll show you again. Holding on to the bottom, you're opening the hand, catching it at the top. And notice here how as I'm doing that, the pillow is staying in the same orientation. So the pillow is not flipping, is not flattening out onto its side. You're trying to keep it upright. So you're kind of balancing it slightly and you're keeping it upright. And you're working on opening and closing at a relatively fast pace such that you don't let the pillow fall completely, right? But instead, you start at the bottom and then you're catching it at the top here. And what I don't want to see is us trying to throw the pillow. So we're not throwing the pillow. I'm exaggerating. I'm sure nobody's doing that. But you're keeping your arms by its side. So your arms essentially stay in the same position. So see how here, without the pillow, my hands are kind of doing this. That's the idea. So we're not trying to get our arms involved. You're just using just a grip to do that movement. The arms stay down. You're just using the grip here. And then once you're at the top, you're going to just move back down to the bottom and do the same thing. Okay. Just like that, nice and simple. So if I go from the side, you can see here how nothing else is moving, right? So if I'm from the side, nothing else is moving. My hands are the only things that are doing this, right? Think like a crab. Although I guess they do move their entire, I guess, arms as well when they're doing that. So maybe that's not the right analogy, but you get what I mean. Okay. And as you're doing that as well, you'll probably notice when I'm letting go and grabbing onto the pillow doesn't really change shape, right? So what I don't want to happen is we're starting at the bottom, and then as we try to grip the top, we're like this, gripping on for dear life to not let the pillow go. Because the idea is you want this kind of a grip, right? So you're gripping with your fingers long still. So we're not gripping like this, right? Where you're trying to squeeze the heck out of the pillow, but you're starting at the bottom and it's kind of like a long sort of finger grip. And then you're just doing the same thing at the top. So almost like you're pinching, but with all of your fingers rather than just the index finger. Trying to not let the pillow change shape as much as you can. Maintain the same shape so you're not squeezing for dear life. Good. Let's do a couple more. Trying to keep those arms nice and still. So remembering the elbows stay relatively still so you can see as I'm doing it if I'm facing the side. It's really just the hands doing this, right? Okay, let's do one more. I said a couple and then I ended up doing more. Good, and let's rest. Okay, we'll leave that pillow We're almost out of time, so we're going to do a bit of a stretch to finish. So place the hand down, the elbow down, sorry, on the table again. And what you're going to do is keep your wrist nice and still. You're going to pull your fingers back. So notice here how my wrist is not moving, but the fingers are going back. So I can stretch those finger flexor muscles a little bit. So see how this, just the fingers going back, different to this, where the wrist is going back. So keep the wrist still, just the fingers and thumb going back, and you're gently pressing back, just to stretch those fingers a little bit more. And then rest. Let's do one more here. Just stretching those fingers back, not the wrist, just the fingers. And coming back. We'll do the same thing the other side. Keep that wrist nice and still, just the fingers going back, using the other hand to just pull those fingers back a little bit more, just to get that stretch. Probably feel that in your palm. Good. Let's do one more. Fingers going back. The wrist stays still, just the fingers going back, stretching that. And back in. Good. Okay. Now we're going to place our palms together like so. And then keeping your palms pressing together, you're going to pull those elbows out to the side, such that you're now stretching the inside of your wrist, right? So it almost looks like a prayer position, but you're starting with your palms together and your elbows relatively close, and then you're going to open those elbows out to the side, and that just gives you a little bit of an extra pressure there to stretch both wrists at the same time. If this is hurting your wrist, don't go as far. Drop the elbows a little bit so it's not as extreme of a movement. If you want more of a stretch, lift those elbows even higher, such that the base of your wrist starts to peel off a little bit. So that gives you a bit more stretch there, as long as you're still pressing those hands together. Good. This time, we're going to turn the palms, the back of the palms together, elbows up if you can. And then from here, you're going to pull the elbows down. So now you're stretching the outside of your wrist, like so. Press the back of the palms together, drop the elbows as far as you can, or as far as you're comfortable rather, because I don't want you to hurt yourself. And then you'll get more of a stretch here. And relax. You're going to clasp your hands together like so, and you're going to reach them forward, and you're going to pull your breastbone back away from the hand. So it kind of looks like this from the side. Hang on. So your hands are like clasped, like so, and you're going to pull the fist forward and pull your breastbone back away. So you're kind of stretching your shoulder blades apart, and you'll probably feel a little bit down the outside of your arm as well, depending on how tight you are. But you're pulling those fists away, and you're pulling the breastbone back away as well. And coming back up. Let's do one more. Reaching the fists away, and then you're pulling the breastbone back. And coming forward again. We're going to bring the shoulders up to the ears. Squeeze as hard as you can for 3, 2, 1, and drop them down. And again, bring the shoulders up to the ears, holding for 3, 2, 1, and drop. Last one. Shoulders up, holding for 3, 2, 1. Drop them down, and you are finished. Thank you, everybody, for joining us for our second class of the Hand and Dexterity series. I hope you enjoyed it, and to those who are new today, welcome. And we will see you next class. Same time, same place, same little towel, same little pillow. Next time, you're going to also need a little rubber band. So rubber band, or if you don't have one lying around, a hair tie will be fine as well. Just something that's a little bit stretchy that we're going to use. But other than that, that's it. Thank you so much, everybody, for joining us. If you have any questions about anything, feel free to drop us an email, which is just at the very top of the chat box, and it's info@parkinson.bc.ca. Drop us an email. We would love to hear from you. The classes will be on YouTube as well if you wanted to look them up. The class from last week is already up on there, so have a look or email us if you're not sure where to find it. Okay, thanks everybody. Thanks for your great comments and thanks for your questions. We'll see you next week. Bye.